welcome back to my YouTube channel. It's me again, Mudube, and I'm here with an impromptu video to discuss colon cancer. I mean, we all woke up yesterday to the devastating news of the death of Chadwick Boseman, who was our hero, our superhero from the Black Panther movie. And I think it was really very shocking and very heartbreaking to hear that he had been suffering with colon cancer for the past 4 years. And I think what we need, the strength we need to get out of that is that he was strong enough to go through all the movies, to act and perform in all those movies that he did while suffering from cancer. I think it's very heartwarming, and it's what he will want to be remembered by. Right now, so like I said, this is an impromptu video, and it's not something I prepared for at all. And the reason I'm doing this is because a lot of people would want to know more about colon cancer, would want to know, more about this disease that has taken our superhero from us. And so today I'm going to be talking a bit more about colon cancer. Now, just to start off with, colon cancer is like is a term used to describe cancer that affects the large bowels. It can also be called bowel cancer, and also could be called rectal cancer if it starts up in the lower part of the large bowel, known as the rectum. It's usually seen in people who are more than 60 years old, but we know that, especially in the case of Chadwick, it can happen in people who are even younger. And so with this video, I'm going to be talking to you about the symptoms you need to look out for, the causes of bowel cancer, and the things you need to do if you suspected you might have colon cancer. Right, so now I'm going to be talking about the causes of bowel cancer. The first one, as I've mentioned previously, is increased age. And so if you are age 60 or above, you're at a higher risk of developing a bowel or colon cancer. But like I said previously, this is not definite, as we know that people who are younger are beginning to have a higher diagnosis of, an increased diagnosis of colon cancer. Now, the second thing is your diet. So if your diet is made up of mostly processed meat or mostly of red meat, you're at a higher risk of developing colon cancer. If your diet lacks fiber foods such as fruits and vegetables, you would also be at risk of developing bowel or colon cancer. Now, the third one is your weight. So bowel or colon cancer is more prevalent in people who are overweight and people who are obese. Lack of exercise as well acts concurrently, because exercise helps increase your metabolism and increases the rate of excretion from your bowels, and hence improves excretion of those toxic materials that free radicals that cause bowel cancer. Now, the next bit will be family history. So if you have a close family relative who was diagnosed with colon cancer, especially if it was diagnosed before the age of 50, you might be at a higher risk of developing colon cancer. There are certain types of colon cancers that run in families, and so if you do have someone in your family who's been diagnosed with colon cancer, it might be worth looking out for the symptoms and ensuring that you get screened as soon as possible if needed. Now, the other causes of the other things that could put you at risk of developing colon cancer will be alcohol use and smoking. These increase the free radicals in your body and increases your risk of developing colon cancer. But as we all know, not everyone who smokes, not everyone who drinks will develop a cancer, but it definitely is proven to increase your risk of developing cancers, any cancer, but in this case, colon cancer. And so it is recommended that if you do smoke, that you quit. If you do take alcohol excessively, that you need to cut this down. what symptoms do you need to look out for if you were suspecting to have that you had colon cancer, or if someone you know was suspected to have colon cancer? Well, there are three, well, I would say specific or important symptoms that you need to look out for. They might not always be present, but just having one of them might be it might be enough for you to get screened. Now, one of which is bleeding from your back passage. So that's bleeding from your rectum. There are other things that could cause bleeding from the back passage, such as hemorrhoids, but these would usually be associated with pain around the area and the lump. And so if you do have bleeding without any associated pain, I think it will be worth getting this checked out. It might not be anything because there are lots of different causes of bleeding from your back passage. But if you fall into any of the above risk factors and you do have this symptom, it will be worth getting this checked out. Now, if you are also noticing some change in your bowel habits, especially if you notice that you're going a bit more frequently and your stools have become looser and runnier and you tend to have diarrhea, and this has been going on for at least 4 weeks, this is usually quite very it's a symptom you need to get checked out, especially if it's not resolving and you've probably had it investigated for infections and that has been ruled out, but you still find that this is ongoing. I think you probably need to get that checked out. Now, you might also have some low abdominal pain or lower tummy pain, which usually gets better when you go to the toilet and pass some stool. But you find that it recurs as well. If you have this, you also probably need to get that checked out, especially if there are other symptoms or other risk factors that you may have. Now, some very non-specific symptoms such as loss of appetite or unintentional weight loss could be associated with colon cancer. And so if you have these in addition to any of the other above, you probably need to get this checked out. So here in the UK, people who are aged between 60 and 74 years are actually offered a type of screening test where they send their stool, their feces sample, their stools to the lab, and this is assessed and for any changes that might suggest that they have colon cancer. This is called a FIT test, FIT test, and it can even detect cancer even when a patient is or the person is not symptomatic. Some people might also have a form of camera test, which is a small tube with a camera at the end of it, which is inserted into the back passage and passed all through your large bowels to assess for any changes at all that might be in keeping with cancer, with colon cancer. And so what do you do if you suspected that you had colon cancer, or if you were worried at all, especially if you fell into the above risk category, and or if you have any of the symptoms I mentioned above? Now, what you need to do is to go and see your doctor. Go and tell your doctor about your symptoms, tell your doctor about everything that you're worried about. If your doctor thought or examined you and thought that you might actually be at risk of having colon cancer, or that you warrant further investigations, your doctor will send you for further investigations, which might be in the form of blood tests, might be in the form of the stool test I just mentioned, and you might also be referred for that camera test I've just mentioned. Now, when you have this camera test, if there are any changes at all in the lining of your large bowels that are thought to be worrisome, that they thought might be in keeping with some changes, they might take a sample of that and send it to the lab to assess properly. And so if you are diagnosed with colon cancer, I need to let you know today that that is not the end of the world. A lot of people who have been diagnosed with colon cancer have been treated and live a normal and full life. I think the trick is to make sure, or one of the things that would improve the outcome would be to detect it early enough and not leave it until it's metastasized or if it spreads to other parts of the body. And so that's why it's good to be aware of the symptoms and to be aware of things to look out for and to get yourself investigated as soon as possible. Okay. If you are diagnosed with colon cancer, the possible treatment will be to perform a surgery to take away the abnormal or the affected parts of your colon, and probably sent to the lab as well. But if your cancer is still within the early stages, that might be enough treatment. But you might also be offered chemotherapy and or radiotherapy to the area. And that's why with all this treatment, you could be cured, but you probably need to be followed up for quite a few years to make sure there are no relapses or recurrence of the disease. But you should be aware that lots of people have been diagnosed with colon cancer and have managed to live a long and full life. And there are lots of support groups around. Look out for people who have been diagnosed with colon cancer and talk to them and draw some strength from other people as well. Right. So like I said, this was an impromptu video and was only made in honor of Chadwick Boseman, who was my absolute hero from Black Panther, and even more so now knowing that he was suffering through colon cancer at the time. And so my heart really goes out to him and his family, and I hope his legacy lives on forever. Please leave a comment in the comment section and let me know what you think about what I've said. And if you've got any other questions regarding colon cancer, I'll be happy to answer them in the comment section. Please like this video, share it with your friends, and don't forget to subscribe to my channel. Until next time, see you later. Bye bye.